What the heck is off-label use anyway? Is it legal? Is it safe? I'm going to break it down for you. Hi, I'm Dr. P. I'm a doctor. I am not an attorney, so always consult your lawyer, your attorney for legal advice. Having said that, I get questions all the time, so I'm going to give you 3 secrets to off-label use. Actually, I'm going to give you a triple 3 secrets to off-label use with this post. Number 1, off-label use is not illegal. As long as the FDA has given approval for a treatment or a medication, for example, doctors, if they deem fit and they inform their patients, can use it in an off-label fashion. Number 2, off-label use is not experimental. Again, as long as the FDA has given approval to something, it can be used off-label. Number 3, and probably most important, if there is no FDA approval, i.e. there is no label, then it can't be used off-label because there is no label, so that is illegal. Second 3 secrets, general medical examples. Number 1, gabapentin. It is FDA approved for use in seizures and post-herpetic neuralgia, big word there, but it's used off-label all the time for insomnia, anxiety, restless leg syndrome, diabetic neuropathy, things like that. Number 2, beta blockers. These are often used on-label for heart conditions, but off-label for anxiety and migraines. Number 3, antidepressants. Medications like amitriptyline, which are used on-label to treat depression, are often used off-label for insomnia and chronic pain. And your third 3 secrets, your bonus 3 secrets, has to do with regenerative medicine and orthopedic and sports medicine. Number 1, MLS laser. Laser is FDA cleared for use treating pain and inflammation, but it's not FDA cleared for wound healing. However, it does help with wound healing, so it's often used off-label to help with wound healing. Number 2, the little gel in here, the hyaluronic acid injection that comes from the rooster combs, that is FDA approved for use in the knee. However, we often use it in other joints such as the hip, the shoulder, the ankle, in an off-label manner. And finally, number 3, this little bare implant that looks like a packing peanut for the bridge enhanced ACL restoration surgery. This is approved to sew in between the ends of a torn ACL to get it to heal in patients for 14 and older. So if it's younger than 14, it's off-label, not that it can't be done. I hope that helps you with off-label versus on-label use. And remember, if there's no label, then it can't be off-label and it's illegal.